This young lady came to us with acute knee pain and swelling following a twisting injury to knee. She was unable to walk or bend the knee. Her clinical examination led us to the suspicion of a lateral meniscus tear, which was confirmed on her MRI scans. MRI report. X-ray before surgery. Assessment of knee before surgery. Knee skin marking before surgery. We did a arthroscopic all-inside lateral meniscus repair of her knee. Torn lateral meniscus. Torn lateral meniscus being probed. Complex lateral meniscus tear. Balancing meniscus using radiofrequency probe. Torn lateral meniscus being repaired with all-inside device. Lateral meniscus repair being tightened. Repaired lateral meniscus. Stable and repaired lateral meniscus. Keyhole, minimally invasive, incisions for arthroscopy surgery. Surgical wound healed well. Comfortable knee movements. Walking partial weight bearing with walker support. It is imperative to protect the repaired meniscus and let it heal naturally by using walking aids and not putting complete weight on the leg in post-operative period for few weeks. Walking independently without support. Complete knee bending and cross leg sitting without discomfort. Follow-up 3 months after surgery. Return to all activities without discomfort. She went on to have excellent recovery with help of physiotherapy and rehabilitation exercises. In young people, it's advisable to save the meniscus by repairing it whenever possible.